distinguished guests, it is a great honor to address you today on behalf of the Republic of Slovenia at this important discussion on investing in the healthcare workforce as a foundation for resilient and sustainable health systems. Universal healthcare ensures access to health services for the entire population, regardless of social status, income, or other circumstances. By ensuring equal care for equal need and by relying on solidarity in healthcare financing, it reduces health inequalities, making this a cornerstone of modern societies. I am proud to say that the government of Slovenia has placed the healthcare system as its highest priority. The measures and investments we have introduced have received strong governmental support, including from the Prime Minister and the Minister of Finance. However, we must recognize that even the highest national priorities face financial limits. It is therefore essential that available resources are used efficiently and in ways that maximize both the quality and the cost-effectiveness of healthcare services. In shaping healthcare policy, we continuously strive to find the right balance. As both demand and supply of healthcare services continue to grow rapidly, we must align them with fiscal constraints and available resources. In doing so, we inevitably encounter the Donabedian model, which provides a framework for evaluating healthcare services through three interconnected categories: structure, processes, and outcomes. As the needs of the population grow, there is a constant requirement to modernize and rebuild healthcare facilities and equipment. Over the past 2 years, investment in Slovenia's healthcare infrastructure, supported by the Recovery and Resilience Fund, the Cohesion Fund, and the central budget, have exceeded the total investment of the previous 10 years combined. However, modernization must be a continuous and stable effort in order to meet evolving needs and avoid major disruption during periods of intensive investment. The most critical investment is in the healthcare workforce. Across Europe, partly as a result of demographic trends, there is a shortage of medical and other health professionals. With the free movement of labor within the EU, the workforce, including health professionals, can move freely between countries. In Slovenia, we are fortunate to see continued growth in our healthcare workforce, both in the number of physicians and nurses. As shortages are most acute in emergency care and family medicine, we have introduced financial incentives of €1,000 per month for physicians who choose to specialize in these areas. We have also implemented measures to reduce administrative burdens on medical staff, primarily through digitalization and the use of AI-based tools. For nurses, we have introduced specialization pathways and developed clearer career progression opportunities to strengthen motivation and improve retention. We have expanded enrollment in medical studies and launched a new medical program which will increase the number of physicians, although the effects will only become visible in approximately 8 years. Investments have also been made in new campuses and in the expansion of the Faculty of Medicine. The salaries of medical professionals have been introduced, and productivity measurement has been introduced, including the possibility of a variable salary component. Our goal is to ensure that medical staff deliver a defined volume of services within their home institutions, as employers cannot otherwise authorize additional work outside this institution. However, everything discussed so far relates to the structure of the system. Ultimately, what matters most are the outcomes for patients. For this reason, we have placed special emphasis on the quality and safety of healthcare services. Over the past 2 years, we have been developing outcome measures, selecting, translating, validating, and digitalizing them. And we expect them to be fully integrated into the central e-health system this summer. Analyzing and comparing outcomes across providers offers valuable insights into service quality, improves cost effectiveness, and supports the sharing of best practices. It also helps identify unnecessary services, which are estimated to account for at least 20% of all services provided in most health systems. Low-value care wastes resources and reduces accessibility for patients who genuinely need services. By identifying providers or services that deliver low-value care, we can improve processes and eliminate inefficiencies, thereby saving resources and increasing productivity. In Slovenia, for example, we have introduced referral criteria for certain diagnostic procedures after specialists identified that some patients were being unnecessarily referred to secondary care. Such practices contribute to low-value care and resource waste, and addressing them requires close cooperation with medical professionals who are the ones to define appropriate referral criteria. Finally, it is essential that all medical professionals recognize that resources are limited. All stakeholders in the healthcare system must share a single clear objective: to provide high-value care that leads to the best possible outcomes for patients. Slovenia remains committed to strengthening accessible, high-quality and sustainable healthcare through cooperation with medical professionals and other stakeholders. Thank you very much for your attention.